Welcome to the Mobile Workforce Podcast, where we sit down and have real conversations with business leaders that have been where you are. During these interviews, we'll dive into what it takes to improve systems and champion processes that maximize performance. Each week, our trailblazing guests share their experiences and understanding of the workforce to help inspire change, challenge our thinking, and share what it takes to successfully travel the road to profitability. Now here's our host, co-founder and chief evangelist of About Time and WorkMax, Mike Merrill.
Hello and welcome to the Mobile Workforce Podcast. I'm your host, Mike Merrill, and today we are sitting down to have a second discussion with our friend Stuart Binstock, the CEO and president of CFMA. Stuart was on the show on episode number 25 a little while back to talk about why construction safety and mental health go hand in hand. If you haven't listened to it, I highly recommend that you go back and give it a listen. I think you'll really enjoy that episode and that discussion. But after recording that first episode, it was unfortunate because we just didn't quite have time to dig into some of the other details on the importance of mental health as it relates to productivity in construction. And so after the inflow of feedback from some of the listeners, we had a request to bring Stuart back and have this further discussion. So excited to have you here today, Stuart. We're grateful for you to join with us, and welcome back to the podcast.
Thanks, Mike. Anytime I can have an opportunity to talk about this subject, which is so critical to the industry, I welcome the opportunity. So I really appreciate this second shot at it.
That's great.
Maybe we'll get it right this time around.
There you go. Now, I think we did a great job. And again, we just ran out of time, right?
Yeah.
So, well, I guess just to start off, just for those that maybe haven't heard the first episode, do you mind just sharing a little bit about your background with CFMA and also the Construction Industry Alliance for Suicide Prevention?
Sure. So I've been at CFMA now for, this is year 11, just started year 11. The organization actually is 40 years old. So that's kind of historic. I've been here for about a quarter of the time. And time flies when you're having fun, Mike. And I'm very proud of what we've been able to accomplish as an organization over the last 10, 11 years. We've increased our membership substantially. But really the hallmark for me is we've increased the value to our membership. And I think, we always talked about when I came on board, let's increase value and members will come. And that's exactly, I think, what we've been able to accomplish. We have a free monthly webinar. It actually, I think last year it ended up being 18 free webinars. We did a great job on the payment protection program. We had, I think, 8 or 9 webinars. They averaged over 1,000 people per webinar. So during COVID, I like to say that not only did we survive, but we thrived because we really met the needs of our members. And we've seen that this year. We were worried about, and quite honestly, we were worried a little bit about renewals, but people renew with the same fervor as they have in the past. And they've actually renewed their memberships at a greater percentage than what we expected and what we thought would be. And I think that's a testament to what we were able to accomplish at CFMA this past year during some very, very difficult times. Regarding CIASP, it is the Construction Industry Alliance for Suicide Prevention. So CFMA started CIASP about 5 or 6 years ago. Cal Beyer, a very well-known person in the industry, wrote an article with Sally Spencer Thomas. We published it in our magazine. We had no idea what would happen when we published that. In fact, Christy Dembowski, our editor of our publication, walked into my office and said, I got an article on suicide prevention. What do we do about that? We both looked at each other and said, well, that's not typical CFMA article. It's not about succession planning. It's not about tax planning. It's not it is not in the controller or CFO's bailiwick, but we published it and the rest is history. We obviously hit a nerve that existed in the industry that no one else was serving. So we're very proud of doing that. And we very quickly realized this was much bigger than CFMA. This was an issue that really permeated the entire industry, with union, non-union, whether you're a craft, whether you're GC, it hit across the board. And so we brought in the entire industry to help us out and now it's a separate entity that services just the subject of suicide prevention.
Wow. And again, kudos and thank you so much for the great work you're doing there. This is not a topic that's in anybody's wheelhouse in construction. Typically, it's not something that we talk enough about.
Right. Absolutely.
So just to kind of seed the discussion just a little bit and recap, a question I would have is, what does the construction industry really need to know and better understand about mental health and the issues that are in the industry?
Well, let me give the context for why we need to know that. And that is construction has either the first or second, depending on how you measure it, first or second highest incident rate of suicide of any industry in the United States. OSHA measures what are called the fatal four. Those are the top 4 ways in which people die by fatalities. So it's falls, electrical, struck by and caught in between hazards. And in 2018, I think those are the most recent numbers we have, 1,008 construction workers died by one of those fatal fours. The estimated number of suicides in 2018 in the construction industry was over 5,000. It's 5 times
Wow.
the fatal four fatality rate. So that gives you some context and why this is so important. This is an issue that has just gone, I wouldn't say it's unnoticed, but it hasn't been discussed. I had the opportunity to talk to 30 of the largest construction companies in the United States about 1.5 years ago. They're safety people. And I am a lawyer, and as a lawyer, you're supposed to never ask a question you don't know the answer to. But I went out on a limb, and at the very beginning of my presentation, I asked, please can I see a show of hands of how many are aware of suicides of employees? And over 2/3 of them raised their hands.
Wow.
Which just kind of blew me away. And I shouldn't say it blew me away, it reinforced what we already knew. It reinforced what we have seen over the last 5 to 6 years when we talk about this issue. It is unbelievable how many people have suffered from this, either themselves or family members or construction companies. So there is a real problem.
Wow. So within the demographic, is there a certain group or subset of individuals that seem to be more at risk with this, or is there any statistics you can share on that?
Sure. Well, first of all, and this is the first time I saw this statistic, but there actually are suicide rates by trade, which I thought was interesting. I had never seen that before. And the highest incident rate is with iron workers, and followed by millwrights, masons, and roofers. So it's interesting that you can actually distinguish amongst trades. But the hallmark of the incident rate and the demographic, basically white men between early 20s through their 50s account for the bulk of suicides. And if you paid any attention to the construction industry, that's the workforce of a construction company. And male-dominated industries tend to have more suicides. 97.4% of the U.S. construction workforce is male. So it shouldn't be surprising that that's a problem. And then there are all these demographics, or maybe talk about the work culture. So, construction folks are very stoic. So they're not going to complain. But there's a lot, people get injured on the job sites and they start taking opioids. And then that's a downward spiral that it goes nowhere very well. The other factors that lead to this, a lot of times folks work remotely. So they live in isolation. They go work, they come home, they probably go drink. They don't have a family life because they're on the road for 6 months. And then I think it's fair to say there's a little bit of access to lethal means. There is kind of a gun culture probably in some parts of the construction industry. And the easier you have access to lethal means, the more likely, you're inclined to do something. So you add all those things up, family separation, sleep deprivation, folks get laid off, the stress on a family from getting laid off because construction sometimes can be seasonal, chronic pain, which leads to opioids. You add all that up, access to lethal means, and it's not a very good recipe for, and unfortunately, it's a recipe for suicide.
Yeah, there's a lot of stark and shocking, really, information that you shared there. I think it makes sense. Makes sense. The demographic, I can understand again that opioids or substance abuse of some kind certainly have a role to play. I would agree with that completely.
Yep.
So with that, one of the things, and the last time we had you on, we talked about some of these things, but an area that we never really had the opportunity or time to drill into is how does this kind of thing, when a tragedy like this happens, whether it's death by suicide or even an accident of some kind, and somebody loses a life out on a project or within the company, what kind of an impact is felt by the organization and even financially? I mean, you're president of CFMA, so that's something that's probably important to talk about.
Well, first let's talk about the impact of a suicide, and then let's talk about just mental illness and mental health and how that impacts the productivity of a company. So I always tell the story. I was talking to an electrical contractor many years ago, and I was talking to him about our initiative here, and he kind of got bug-eyed. He looked at me and he said, "How'd you find out about us?" I said, "What are you talking about?" He said, "We've had 3 suicides in the last 18 months. So the last one was at a Fortune 100 company. One of our foremen died by suicide by hanging himself in the boiler room of a Fortune 100 company. His spouse sued us, blaming us for the suicide. The Fortune 100 company called up the company and said, 'I'm not sure you guys can work at our shop anymore.' This guy was the president of the company, he had to go out to the Fortune 100 company, which was in the Midwest, and they're based elsewhere, and explain to them how they were going to continue to work in the environment after one of their people had just died by suicide in their boiler. You just think about that for a second. You're getting sued. It speaks to your credibility with a Fortune 100 company, and what's the attitude or the mood of the people on your workforce. You add all those up, and there's a lot of lost time and a lot of cost involved. So let's talk about short of a suicide. Let's just talk about mental health problems. So these are, I think, national statistics, and they're not necessarily related to construction, but they're overwhelming. Mental illness results in 200 million lost workdays per year. In a 3-month period, a depressed person will miss 4.8 days of work and 0.5 days of reduced productivity. $44 billion per year is estimated in lost productivity. And a person suffering from depression consumes, and this is an interesting statistic, 2 to 4 times the healthcare resources that someone who's not depressed. So think about all those costs that are really hidden costs. And 1 in 5 adults will experience some form of mental illness, they say. That's 43.8 million people. 60% are left untreated. 7% have depression. 18% have anxiety. And this can lead up to 27 lost workdays per year. Depression is the leading cause of disability and increases risk of other chronic medical conditions. So you just start to add all that up, and it's kind of overwhelming. So let's talk about maybe some other factors. A $1 investment in mental health results in a $4 return on investment.
Wow.
So this is good business, and I think I will tell you that we've gotten involved recently in the diversity and inclusion issue as well. And Contractors won't necessarily do the right thing because it's the right thing to do. But if you can make a business case, then they'll listen. And there's a business case to address this, just like there's a business case to address diversity and inclusion. So 33% of workers' comp claims in men and 66% in women had an existing mental health condition. And 50% report symptoms of depression in the month following an injury. And nearly half have a co-occurring substance abuse disorder. So, when we talk about suicide, let's talk about way short of suicide and just mental health and all the impact of this on a company. It's a hidden cost that nobody really understands. And those statistics, people, I think, are going to be eye-opening for people. And I think they'll make them think twice about, we're not necessarily always talking about suicide. We're talking about mental health. This is part of mental health. Unfortunately, the ultimate act of losing your mental health is suicide. But before you get to that, there are all sorts of things that can happen and all sorts of things that can really hurt a company from a productivity standpoint.
Yeah, so what I'm hearing you say, and it makes perfect sense, if we can attack the issue at the root before it becomes more severe, we can prevent far more suicides by addressing the mental health issues. And then I also heard that a lot of them seem to stem from maybe an injury. So giving extra attention to those that have had an injury and making sure that they have a clear path to recovery, maybe have the extra attention and resources that they need to get back into good health is probably a very good preventative cause for some of these issues that can come down the line.
Absolutely. I mean, I think we've all heard, and it goes way beyond construction, but we've talked about opioid use in this country. And but in the construction industry, opioid use would primarily probably is connected to injuries and then taking some kind of opioid and then getting hooked on the opioid. And then goodness knows what happens after that, and possibly suicide. But certainly a loss of productivity at the very, very least.
Well, and I think everybody listening, and you and I included directly, we've all had bad days at work, and where we just didn't get as much done. We weren't very productive. So if we have something that is recurring and persistent, that's causing us that issue or those challenges, then it only makes sense that they don't lead to anywhere good and certainly nowhere productive.
Yeah, well, I mean, think about having a bad day and then thinking about having anxiety or depression on top of that.
Yeah, every day.
Every day. And think about how effective that employee is going to be. And think about how do you find out about that? That's kind of, I think, probably a major question that people might ask is how do you know that you're dealing with, a disgruntled employee or a depressed and anxious employee, and so, there are warning signs, and at the Construction Industry Alliance for Suicide Prevention, we have little cards that you can purchase that talk about what are the warning signs for, for depression. And so there are things like feeling sad or depressed most of the time, increased use of alcohol or drugs, feeling hopeless and helpless, sleeping too much or too little, withdrawing from family and friends, talking about being a burden to others. Those are kind of all signs that someone's going through something. And then in construction, there are actually some construction specific warning signs. Once again, decreased productivity, increased conflict among coworkers, near hits, injuries and accidents. So someone's not paying attention, their mind is elsewhere. Decreased problem solving ability and increased tardiness and absenteeism. So you add all those up, and it's not a perfect formula. You're not going to get this right all the time, but if you know the warning signs, is important. We don't expect, we at CFMA, the CISP, we don't expect people to be mental health experts. That's really not what CIASP is all about. It's all about, kind of understanding what are the possible problems and getting someone help.
Yeah, I keep thinking of the old adage my mother used to say all the time that an ounce of prevention is worth a pound of cure.
There's a lot of truth. There's a lot of truth to that. And then, and as we discussed, it really has a monetary impact on the construction industry. I mean, a serious monetary impact. If someone's not going to do it, because it's the right thing to do, it's also the right thing to do from a business standpoint.
Yeah, fascinating. And again, not something that we hear enough about. I think back to my career in construction for over a decade, and this is going back a couple of decades, and I don't remember anybody ever talking about it at that time. So,
well, Mike, let's add another layer to this. How about the last year and a half in COVID?
Yeah.
I mean, talk about putting stressors on people. So there's a lot of anxiety in the world today. Hopefully, it's lessening, and hopefully people get vaccinated. We can return back to normal. That's my little pitch. But that has nothing to do with suicide prevention. My own personal pitch: for God's sakes, get vaccinated. But I mean, just really think about it. Add everything we just talked about, and then think about COVID over the last 15 months, and how the stressor that is put on people, on families, on construction companies, really on the whole world.
Well, and tragedies are always, I tend to view the world this way. I try to view it this way. Tragedies are always an opportunity to regroup, to buckle down, to improve, to learn. And let's use COVID, if nothing else, to raise awareness and to be more in tune with the mental health and just the general well-being of our coworkers, of our work family, of our employees.
Yeah, I speak at a fair number of places, and so I'll go to safety and health conferences, and they'll say, you're all fine talking about safety. Wear a hard hat. You have toolbox talks. I get all that. But when it comes to health, health's a little more complicated. But mental health, nobody wants to talk about that. It's hard. It's complicated. It's not an easy issue. So it's kind of, I don't think we need to blame people and blame the industry. It is understandable that people don't want to talk about mental health, but we're at the point where, and Cal Beyer, the father of this whole initiative, talks about removing the stigma. Get away, we need to talk about it. And that's the only way this issue is going to get better.
Yeah, and I think you mentioned, when you mentioned that, I think of, a lot of people are aware of Alcoholics Anonymous or other organizations where admitting that there's a problem, as an industry, that's something we just need to be better at.
Yep. And I'll tell you, interestingly enough, they're better at this in the UK and Australia. I can't really explain to you why, but they have a program called Mates in Construction in Australia. They have a budget, I think, of like $1.5 million to spread the word about this issue. And ours is a fraction of that. We're 10 times the size of that country. So it is something we need to spend more time on.
Do you have any ideas or thoughts on what companies can do to at least take a first step towards this? Are there programs, are there websites, resources?
Yes. So I'm glad you asked that question, Mike. So the website for CIASP is preventconstructionsuicide.com. www.preventconstructionsuicide.com. There are a host of resources on the website. One of them is, how do you evaluate a company's mental health and suicide prevention, preparedness, and culture, which is a very long word, but it's really an expression, but it's kind of a needs analysis and implementation. So you can go in to the website and kind of almost check off whether you're doing this or you're not doing that, and it'll give you a good sense of where you are on the continuum of what probably would be ultimately the most enlightened company and the company that's treating this the best versus the worst, depending on kind of what you come up with as a score after you do this needs assessment. But I think that's a first step, to do kind of a needs assessment. And then the second is to start doing some training. We have some training programs on our website. They're like, I think one is like an hour-long course that just gives you a real overview about preventing construction suicide, what you should do if you're with somebody and you think they might be suicidal. And these are very troubling and difficult issues, particularly for someone who's a layperson in that area. So there are a host of things you can do, and you know, the first thing I would tell people is get started, do something. That's really kind of my mantra when it comes to this subject.
Yeah, and I can't help but think as well, you know, you talk about the productivity and the lost productivity, but even if I feel like I'm doing fine, if my buddy to the right or to the left of me is not, and heaven forbid they have an accident or a mental lapse or a challenge, it's going to affect me as a crew member. It's going to affect my project. It's going to affect my mental stability too, to my concern and my worry. I can't help but think that the ripples that occur from an issue like that don't reach everybody in the company.
I think they're of enormous proportion, Mike. You're absolutely right. They're from the person who works next door to the person in HR who's got to deal with a death in the organization, to the CEO who's got to worry about the liability that the company might face because somebody might sue them and blame them for the suicide. I mean, it's endless. It really does cut across the whole, the foreman who might think he's going to get blamed for, you know, pushing somebody too hard. I mean, really, when you think about it, it cuts across the entire company. A suicide cuts across the entire company.
Yeah, and we all know socially when somebody passes that we're connected to, even in our personal life, the impact that's felt by hundreds or thousands of people immediately that they're gone and grieving. And, you know, it's going to do the same thing in your work life. So
absolutely. Absolutely. It is going to definitely have a devastating, well, I mean, I think it's going to have a devastating impact on your company, but I don't think you even understand what impact it will have on your company. And it'll be different for every single organization, just depending on the makeup of the company, makeup of the person, makeup of the way they handle the situation. There's unimaginable opportunities for a problem and for something bad to happen when something like that happens to a company.
well, and in an environment where, again, we have all these other stresses with lumber pricing and concrete prices and steel prices, and people are busy and you can't find enough good help. And we're already running around probably a bit frayed and ragged as an industry right now. So,
and you know, let's think of something that, of course, we all think is a great opportunity, but from this perspective, the unintended consequence could be negative, and that is the infrastructure legislation, which is a great opportunity for the industry. But if the industry is not manned enough and ready to do that, and we've always talked about worker shortages. Before COVID, well, we do a Confindex survey every quarter. We ask our members, you know, what their confidence level is, and we ask them what are the top 5 issues that they're concerned about. And worker shortage prior to COVID was 5 times higher than any other single factor. So post-COVID, when everyone's back, then the infrastructure bill passes. Oh my God, the concern about worker shortage. And, you know, I have seen people talking about prefab and robotic. There's got to be a solution because with the current workforce, we will not be able to handle what's coming through the pike.
yeah, and we both know, and I've had a couple of guests on here. Letitia Henke runs a contractor school out in California to teach young roofers coming out of school to be trained up in the trades, and has just a wonderful program called the Lime Foundation. And you know, we're seeing it everywhere. It's not just in California where there's just major worker shortages as it is.
Yep.
So we just can't afford as an industry and as a society to keep looking the other way, whether it's intentional or not. We really need to put our eyes fixed on this issue and start making some changes.
Well, I will tell you, and I know people never think of it this way, but you could think of this from a recruitment standpoint. A company that is known as a caring culture and takes care of its people are going to want to work for that company. And I think millennials, even more so, seem to be a little bit more independent than some of us old folks. And I think they look at that kind of stuff more than I think our generation did. And so if you come across as not being a caring culture, I think you have an issue in terms of your future employees. So it's a recruitment tool. No one ever thought mental health was a recruitment tool, but I think it really can be perceived that way.
Well, I love that you bring that up. And people generally, we're feeling caring beings. So they know when you're interested in them from a perspective, from an emotional perspective. They know when you care about them. And I think you're right. I think a company culture has that same spirit of what that company is about. And I think people will take notice.
I think so. Yep.
All right. Well, thank you again for this great conversation, Stuart. Before we hang up here, I just wanted to check in and see, is there any meetings or conferences or opportunities that CFMA has coming up that the listeners can participate in or sign up for?
Well, Mike, now that you mentioned that, of course there is. Our annual conference and exhibition this year is going to be a hybrid. Last year it was all virtual. This year we're going 2.0 virtual, which means we're going to be live in 4 cities, Dallas, Texas, Phoenix, Arizona, Atlanta, Georgia, and Washington, D.C. So we're going to have a limited number of people that we're going to allow to attend in those 4 cities and have the opportunity to network and with one another. And everyone else, it will be virtual. It's July 19 to 23. It's interesting when you do a conference like this. I think we have more sessions and more CPEs than we would if we were, at a live event. We have 32 sessions. We have 60 CPE credits. And I know one of the things that's always popular with our members are the small, medium, and large firm roundtables, where contractors get to talk with similarly sized companies about issues that are troubling them. So love to have people attend that. And all the information is on conference.cfma.org.
That's great. Well, thank you, Stuart. And I highly encourage everyone to check that out. We've been members of CFMA and involved for going on 11 years now. And I know that, again, I think I said this on the first podcast we did, CFMA always continues to grow. It never shrinks. Nobody ever leaves it. They just keep coming and coming and coming. So we're excited to have more people come and join in the conversations and the education happening there.
Thanks so much, Mike.
You bet. So tell me, Stuart, if you were to sum up the conversation today and boil it down to one key takeaway, what would that message be for the listeners as we wrap up today?
2 words, Mike. Do something. Do not sit still. Do not say, oh, this was an interesting conversation and it's somebody else's problem, because it could be your problem tomorrow. And you have an obligation to your employees, and you have an obligation to yourself as a company to, you can think of this, Mike, as a risk management issue as well. There's so many ways to think of this issue, but the bottom line is do something. You can start out small. You can maybe train some of your supervisory staff so that they're familiar. Then we have a host of information available on the website that you can use free of charge. And so we really want people in the industry to use the material that we've created. We do accept contributions from people, but we don't have membership fees. We're just trying to do the right thing and do the right thing for the industry.
I love that. I'm hearing Stuart tell the audience, take action, right?
You just took my words and you put them into yours, and they work very nicely, Mike.
Great. Well, again, thank you so much for the great work you're doing with both of these organizations, CIASP and of course CFMA. Strongly encourage the listeners to please take a look at those websites. Again, CFMA is doing a lot of great work, not just in suicide prevention and mental health, but also in your construction financial management roles. And they are a great help to many companies all around the country. And I strongly encourage you to take a look at what they're doing and get involved.
Thank you, Mike.
Thank you again, Stuart. And thank you to the listeners. I appreciate your listenership today and tuning in. Stuart and I are longtime friends, and I've really enjoyed this second conversation that we've had. Look forward to having him on in the future and sharing other pearls of wisdom with us. So
it's a pleasure, Mike. I really appreciate the opportunity.
You bet. All right. And thank you again, listeners. Please tune in and give us a 5-star rating and review, and also share this podcast episode with your friends and associates in the industry. After all, we are not only trying to help you improve your business, but your life.